We have new information on the coronavirus tonight.
This isn't overhyping or political or a scare technique. This is exactly what we're seeing in the hospital. When we have 50, 60, 70 patients in the hospital, we're seeing severe pneumonias. Somebody inadequately filled out a death certificate with the actual thing that made the person die.
A new CDC report says only 6% of COVID-19 deaths listed the virus as the only cause.
The other 94% also had other health conditions. You may have seen this report circulating on social media since it surfaced last week.
Many KOLR 10 viewers are weighing in on the conversation. There are some who argue the COVID statistics have been overhyped. While we have always reported factual numbers provided to us by local health officials, we wanted to get more perspective on these new CDC numbers. Our Robert Yaley sat down with an infectious disease doctor to break down the report.
I think what we're seeing is a messaging flaw with the CDC. 6% of deaths just means that 6% out of the time, somebody only filled in the blank with that one disease.
Dr. Robin Trotman is an infectious disease doctor at Cox Health. He helps local and state leaders guide coronavirus policy. Trotman says the confusion in this study is about death certificates, more specifically the cause of death and underlying conditions.
So if somebody has COVID-19 and they come in the hospital, they're on the ventilator, and then they die from respiratory failure, we would put respiratory failure as the cause of death, and then coronavirus would be on a list, like a sub-list.
Trotman says there's specific guidelines on how to fill one out, but it's very rare that a doctor would only list COVID-19 as the cause of death because the virus in itself doesn't cause death.
It causes pneumonia, which results in death. So what you're seeing there is inadequate work on a death certificate.
COVID-19 deaths are up to 183,000 in the U.S. Trotman says the overwhelmingly majority are from respiratory failure. But what about deaths where COVID-19 is clearly not the cause, but a patient had the virus as well? Are those deaths misleading, and do they inflate statistics?
For instance, if there was an accidental gunshot or just something horrific and they had a swab and they came in and they were asymptomatic, that would not be the cause of death. So that is not what is causing this 6% of numbers. Those are one-off, very rare cases where you have an asymptomatic person who has a very clear, discrete other cause of death. And most people wouldn't actually put that in the death certificate as a cause.
However, many local residents are still unhappy with things like city mask ordinances and occupancy limits for businesses. One of the key arguments in a lawsuit against the city of Springfield is the low COVID-19 death rate. Less than 2% of people have died. Should that force everyone else to change their lives?
This isn't an argument to universally mask. This is an argument to say there are other non-mortality based complications of this virus. You can't just assess the severity based on death rates. And to dehumanize it and say, I mean, that's just cruel to say 2% of people are dying. I mean, those are people's families.
As Robert Yaley reporting, Trotman cited some examples from several studies. A large number of patients still have symptoms months after recovery. Plus, 40 to 50% of people who didn't get the virus develop onset anxiety or depression. Trotman believes the economic impact of an outbreak is far worse than preventative measures we're doing now.